All of our patients universally would like to use their own eggs, and it's a very important decision if they're found that their own egg quality is inadequate to support getting pregnant. And we help patients through the process of trying to evaluate what they really want. And if the patient decides ultimately that they would like to carry a pregnancy, egg donation offers a great alternative for them. We help them select the egg donor. We work with a variety of agencies here in California that really help them go through the process without feeling intimidated. Once they've selected an egg donor, then we'll work with them throughout the course of several weeks to prepare them for the transfer and make sure that their donor has the best possible outcome.
Our surrogacy program at HRC Pasadena is one of the largest in the world. We don't have surrogates for our patients directly. We work with a number of surrogacy agencies throughout the country. The benefit to our patients is that it allows them to find the most appropriate surrogate for them. They're not confined to a very limited pool.
We vet the candidates for surrogacy very carefully to ensure that the outcome is going to be the best possible outcome for the patients. Surrogacy is a lot more intimate than egg donation, or IVF for that matter, because you're dealing with a third party, a person who's going to be carrying the pregnancy.
Also, we've just been doing surrogacy for about 20 years and just have a great amount of experience about how to appropriately synchronize the cycles between the woman who's producing the eggs and the surrogate who's going to carry the pregnancy to maximize her chance for success.
Pre-implantation genetic screening is our ability to look at an embryo and look at its genetic characteristics and traits.
There's really three primary reasons for couples doing PGD. One is women with advanced maternal age that we know as they get older they have a greater chance of releasing chromosomally bad eggs, so we can look for the chromosomally normal embryos to do a transfer and maximize their chance of having successful pregnancies. There's single gene disorders in couples that have proven genetic abnormalities being transmitted through the families, like cystic fibrosis, Tay-Sachs, so we can specifically identify those disorders in families at risk. And finally, for gender selection, whether gender selection is for gender-related diseases, like hemophilias and mental retardation disorders, or whether it's simply for family balancing. Patients should come to HRC for 24-probe technology because it's just the latest advancement in the technology associated with pre-implantation genetic diagnosis. Every embryo has 23 chromosomal pairs inside. And before, because of the limitation of technology, we could only test 5, maybe 10 of those chromosomal pairs. With more recent technology, we can now look at all 24 pairs of chromosomes and accurately determine their integrity. And therefore, we have a better chance now than in the past, through 24-probe technology, of truly knowing the chromosomal complement of the embryo and having a better chance to pick the best embryos to give the patient the best chance to conceive a healthy baby.
In the old days, before the genetic screening occurred, clinics were uncertain which embryos to put in, so they put in a lot of embryos, and sometimes a lot of those embryos took. We've seen the stories in the news. But by screening the embryos, becoming more responsible, transferring single embryos to our patients, we achieve pregnancy rates that are equal to clinics that are putting in 3 to 4 embryos in their patients, yet avoiding the risk of multiple gestations.